Let's take the case of a particular cancer patient. They come to you with their documents. What documents? They'd have a scan, they'd have their blood tests. Is that what they need?
I tell my patient, bring everything that you have. So I learn how to read medical reports. I think it's not that difficult. Of course, with the medical reports, they also have their CT scan or their ultrasound or their mammogram, whatever it is. Well, I'm not a radiologist, and I'm sure many others also are not radiologists, so we are on even footing on that. But I did spend a lot of my time reading books on how to interpret images, whether it could be CT scan, whether it is X-rays, whether it's ultrasound. I did spend a lot of time on this. In fact, I went into various journals on imaging. I want to know how do they interpret all those images. So I'm not an expert in this, but I understand what happens. And then based on the CT scan report or on the imaging report, then I can put the two and two together. And of course, there's another recording would be the blood test. So we also make arrangement that our patient, if they don't want to see the doctors, they can go to the private laboratories to do the blood test. And we monitor progress of our patient through blood tests as well.
Right.
So I think we operate in a scientific way, in a rational way.
Yes. How do you decide, when you're looking, do you say, oh, this is a lung cancer case, therefore I'll give these herbs?
Yeah.
Or do you look at the blood tests and say, oh, there's this and that, and so we'll give some herbs for this and herbs for that?
Oh yes, we operate in a very holistic way. I am here not only treating your cancer, I'm treating their person.
Right.
Therefore, we take into account of everything. You know, when a girl came that she has breast cancer or she has a breast lump, from the medical point of view is that the doctor will only look at the breast and they don't go beyond that. No, I will always ask about problem of their menses, their periods, you know, because we know that menstrual problems also result in breast lumps. So instead of just taking care of your breast, you also take care of the ovaries and the uterus and many other problems. So it is a very holistic thing. So back to your question, that's when we look at the report and the CT scan, oh, you got lung cancer. Of course, we will look at your blood test as well, whether what happened to your blood. And most of the time, if you have chemotherapy, most of the many parameters of your blood is really gone. And then it could have spread elsewhere as well. So we give herbs accordingly. And besides just the cancer, when you say our patient could be suffering from a lot of phlegm, could be having difficulty breathing because there could be fluid in the lung. They could have cough, a whole variety of cough. Some of them cough blood, some of them cough because it's itchy, some have got phlegm, some got phlegm got stuck in the throat, and all variety of things. And mind you, we have a whole range of cough herbs specifically to treat all this problem. This is not just one cough herb for everything. If you have an itchy throat, we'll give you an itchy cough. If you have a phlegm, like a cough that you feel that your phlegm got stuck and cannot remove, when they give you, I say, cough number 12, that's specifically for that. But if you have a cough that you put out blood, we'll give you cough number 1, that's for blood. And if you cough out, you have a yellow phlegm, we'll give you cough number 3. If you cough out white phlegm, we'll give you number 5. So it's all specific. We know exactly what we want to do. So it is just not a matter of that, oh, you've got lung cancer, take this X.
Right.
No, we treat you as a person. And that's the reason why we feel that the patient really benefit. They come back, they'll see, wow,